Your mother needs brain surgery immediately. Dr. Reeves's voice came through the phone like thunder on a clear day. I was standing in my kitchen, holding a cup of coffee that suddenly felt too heavy for my hands. My son Marcus was calling from across the country, breathless with urgency. He'd been at my neurologist appointment. I hadn't been. That sentence should have stopped me cold. But I was already confused, already worried, already doubting myself. Marcus had convinced me weeks earlier that I should let him attend my appointments. "Mom, you forget things now," he'd said gently. "You need someone taking notes, someone who can remember what the doctors say." I was 58 years old. I'd run my own accounting business for 30 years. But lately, I had been forgetting things, small things. A client's name, where I put my reading glasses, the date of my sister's birthday. So I'd agreed. Now Dr. Reeves was telling me through Marcus that I had a significant abnormality, a growth, something that needed immediate surgical intervention. The words blurred together: abnormality, growth, intervention, surgery. "What kind of growth?" I asked, my voice smaller than I recognized. The coffee mug found its way to the counter. I couldn't hold it anymore. "Dr. Reeves says it's pressing on your frontal lobe," Marcus explained. "That's why you've been forgetting things, why you've been confused. He wants to schedule the surgery for next month." I tried to remember the appointment. I'd been there. I'd sat in that office with its beige walls and motivational posters about brain health. Dr. Reeves had shown me something on the computer screen, an image of my brain. But I couldn't remember what he'd said about it. Couldn't remember if he'd used the word surgery. Couldn't remember anything except his calm, professional demeanor as he'd pointed at various sections of the scan. "Mom?" Marcus was waiting for my response. "Are you there?" "I'm here," I said. I need to think about this." "There's nothing to think about," Marcus said, and I could hear the concern in his voice. The love. Dr. Reeves was very clear. "This is urgent. If you wait, it could get worse. You could have a stroke. You could lose your memory completely. You could—" He stopped himself. "You need this surgery." That was the beginning, the moment everything started to shift, though I didn't know it yet. Marcus lived in Seattle. I lived in Portland. He'd taken a week off work to come down for my appointment. He'd stayed at my house. He'd made me breakfast. He'd been so attentive, so caring. He'd also been dropping hints about my memory for months, about how I'd repeated stories, about how I'd seemed confused during our video calls, about how he worried about me living alone. The day after the phone call with Dr. Reeves, Marcus sat across from me at my dining room table with his laptop open. "I've been researching," he said. "I found the best neurosurgeon in the Pacific Northwest, Dr. Helena Voss. She's at Oregon Health and Science University. She specializes in exactly this kind of surgery." I stared at the screen, at the credentials, at the photos of this woman who would apparently be cutting into my skull. "I've already called," Marcus continued. "They can see you next week. I've arranged to take another week off. I'll drive you to Portland. I'll be there through the surgery and recovery." "Marcus, Mom." He reached across the table and took my hand. "I know you're scared, but this is the right thing to do. I wouldn't push this if I didn't believe it was necessary. You're my mother. I love you. I need you to be okay." The weight of his words pressed down on me. The love in his eyes. The certainty. When had I become someone who needed this kind of care? When had my memory become so unreliable that my own son had to make these decisions for me? I scheduled the appointment with Dr. Voss. The week before I was supposed to meet her, I called my sister Eleanor. She lived in Eugene, about 2 hours south of me. We talked maybe once a month, usually just quick phone calls. But I needed to hear her voice. Needed someone outside of this situation to tell me I wasn't losing my mind. "Eleanor, I need to tell you something," I said when she picked up. "I'm having brain surgery." There was a long pause. "What?" I explained everything. The appointment with Dr. Reeves, the abnormality, the growth. The surgery scheduled for 2 weeks out. Marcus's involvement. His research. His certainty. Eleanor was quiet for a long time. "Adara, did Dr. Reeves tell you this directly?" "Well, no. Marcus was there. He called me afterward, and—" "Did you see the scan yourself?" "Yes, but I didn't understand what I was looking at." "Did Dr. Reeves use the word surgery?" I tried to remember. Tried to pull the appointment from my memory like it was a file I could access. But it was fuzzy. Uncertain. I'm not sure. Marcus said he did." "I think you should get a second opinion," Eleanor said. "Before you do anything as serious as brain surgery, get a second opinion from a neurologist who you talk to directly, not through Marcus." "Eleanor, Marcus wouldn't lie to me. He's my son." "I'm not saying he's lying. I'm saying that you should verify this information yourself. You should hear it directly from the doctor. Can you do that?" I promised I would, but I didn't, because by that point, I was already doubting myself so much that I wasn't sure I could trust my own judgment. If I couldn't remember things, how could I trust my memory of the appointment? How could I trust my interpretation of what the doctor had said? Maybe Marcus was right. Maybe I was losing my mind. Maybe I did need this surgery. The appointment with Dr. Voss was scheduled for a Tuesday morning. Marcus picked me up at 7:30 in the morning. He was wearing a polo shirt and khakis, like he was going to a business meeting instead of accompanying his mother to a neurosurgery consultation. He looked tired. He looked worried. "How are you feeling?" he asked as we drove toward the hospital. "Terrified," I admitted. "That's normal," he said. "But you're going to be okay. Dr. Voss is the best. You're in good hands." OHSU rose up in front of us like a fortress, a place of healing and expertise, a place where people went to be fixed. We parked and made our way through the corridors. Marcus held my elbow like I might fall, like I might forget how to walk. The waiting room was full of people in various states of medical distress. A woman with a bandage wrapped around her head. An elderly man with his arm in a sling. A younger man who kept rubbing his temples like his head was about to split open. When they called my name, Marcus stood up with me. "You can come back," the nurse said to him. "But the doctor will probably want to speak with your mother alone first." I watched Marcus's face, watched something flicker across it. Disappointment? Concern? It was gone so quickly I wasn't sure I'd seen it at all. Dr. Helena Voss was younger than I expected, maybe early 50s. She had sharp eyes and an efficient manner. She shook my hand and gestured for me to sit. "I've reviewed your scans," she said, pulling up the images on her computer. "And I've read Dr. Reeves's notes. I'd like to ask you some questions before we discuss any treatment options." Treatment options, not surgery. Options. The distinction felt important, though I couldn't have said why. "Of course," I said. "When did you first start experiencing memory problems?" I thought about this. "A few months ago, maybe 3 or 4 months. Just small things at first. Forgetting where I put my keys. Forgetting a client's name. That sort of thing." "Has it gotten progressively worse?" I'm not sure. My son says it has, but I'm not entirely sure I notice it myself." Dr. Voss made a note. "Any headaches?" "No." "Dizziness?" "No." "Vision problems?" "No." "Difficulty speaking or understanding speech?" "No." "Any weakness in your limbs?" "No." She asked me a series of cognitive questions. What year was it? Who was the president? Could I count backward from 100 by sevens? Could I repeat a series of numbers she gave me? I answered all of them correctly. Or at least, I thought I did. She didn't tell me if I was wrong. I'm going to be very direct with you, Dr. Voss said, turning away from the computer to face me fully. The abnormality on your scan is very small. It's not pressing on any critical structures. It's not causing any symptoms that I can detect from our conversation. It's not growing, according to the baseline scans from your previous imaging. And frankly, the symptoms you're describing, minor memory lapses, occasional confusion, are completely normal for a woman your age. They're not indicative of a brain tumor or any other serious pathology. I stared at her. The words didn't make sense. They contradicted everything I'd been told, everything I'd believed for the past week. Are you saying I don't need surgery? I'm saying that based on my evaluation, I would not recommend surgery at this time. In fact, I would recommend against it. Surgery on the brain is a serious intervention with real risks. Infection, bleeding, stroke, loss of cognitive function. We don't perform brain surgery on asymptomatic patients with small, stable abnormalities. The risks far outweigh any potential benefits. The room tilted slightly. I reached for the armrest of the chair and steadied myself against it. What should I do? I asked. I would recommend continued monitoring with MRI scans every 6 months to a year. I would recommend that you see a neurologist regularly. But I would not recommend surgery. Not now. Possibly not ever, depending on how this develops. Dr. Reeves said, I don't know what Dr. Reeves said, Dr. Voss interrupted gently. But I'm telling you what I'm seeing. And what I'm seeing is a woman who is cognitively intact, who is experiencing normal age-related memory changes, and who has a small, stable abnormality that does not require surgical intervention. I left that office in a daze. Marcus was waiting in the hallway, standing up immediately when he saw me. What did she say? He asked. When do they want to schedule the surgery? She said I don't need surgery, I said slowly. She said the abnormality is too small. She said my symptoms are normal. Marcus's face changed. His jaw tightened. His eyes narrowed. For just a moment, I saw something in his expression that I'd never seen before. Anger. Real anger. Then it was gone, replaced by concern. Dr. Voss is being overly cautious, he said. Dr. Reeves is the one who's been treating you. He knows your case better. He recommended the surgery for a reason. She said the risks of surgery outweigh the benefits. She's wrong, Marcus said flatly. We were walking toward the elevator now. He was walking fast. I had to hurry to keep up. You need this surgery, Mom. I don't know why she's discouraging you from it, but you need to trust Dr. Reeves. He's your neurologist. He knows what he's talking about. But she's a neurosurgeon. She specializes in this. And she's being overly cautious, Marcus repeated. That's the problem with doctors sometimes. They're too afraid of liability. They won't take risks even when the risks are worth it. We got in the elevator. The doors closed. Marcus stared straight ahead at the brushed steel doors, his jaw working. I'm going to call Dr. Reeves, he said. I'm going to find out why he and Dr. Voss have such different opinions. There's something not right here. But something was right. Something had shifted in my understanding of the situation, and it had shifted in the wrong direction, away from trust and toward doubt. Doubt about Marcus. Doubt about what he'd told me. Doubt about whether he was really trying to help me or whether he was trying to manipulate me. I didn't say any of this to Marcus. Instead, I rode home in silence while he talked about getting a third opinion. While he talked about how sometimes you had to be your own advocate in the medical system. while he talked about how he was only trying to help me. That night, after Marcus had gone to bed, I did something I should have done weeks earlier. I called Dr. Reeves' office and asked for my records. All of them. Every note from every appointment, every scan, every test result. The receptionist said they would mail them to me, but she could email the scans. Within an hour, I had PDFs of my brain imaging on my computer. I opened them and stared at the images. They meant nothing to me. They were just pictures of a brain. My brain. But I couldn't see what was wrong with it. I searched online. I looked up brain abnormalities. I looked up the specific type of growth that Dr. Reeves had supposedly identified. I read medical journal articles and patient forms. I learned that small, asymptomatic brain abnormalities were incredibly common, that many people lived their entire lives with them and never knew they were there. That surgery was rarely recommended unless the abnormality was causing symptoms or growing rapidly. My abnormality was not causing symptoms. According to Dr. Voss, it wasn't growing. I called Eleanor back. "I need to tell you something," I said. "I saw the neurosurgeon. She said I don't need surgery." "What did Marcus say about that?" "He said she was being overly cautious. He said I should get a third opinion." Eleanor was quiet for a moment. "Adara, I need to ask you something, and I need you to answer me honestly. Has Marcus ever asked you about your finances?" The question caught me off guard. "What? No? Why would he?" "Just think about it. Has he mentioned anything about money, insurance, your will, your accounts?" I tried to remember. There had been conversations, casual conversations that hadn't seemed significant at the time. Marcus asking if I'd updated my will recently. Marcus suggesting that I should probably put him on my accounts in case something happened to me. Marcus mentioning that my insurance premiums seemed high, and that maybe he could help me manage my finances. "He's mentioned some things," I said slowly, "but he said it was just because he was worried about me, because he wanted to make sure I was prepared." "Or because he wanted access to your money," Eleanor said bluntly. "Adara, I think Marcus is trying to control you. I think he's trying to make you believe that you're sicker than you are so that he can justify taking over your life. Your finances, your medical decisions, everything." "That's a horrible thing to say about my own son." "I know it is. But you need to consider the possibility. You need to think about the timeline. When did he start suggesting that you were having memory problems? When did he start coming to your appointments? When did he start talking about your finances?" I thought about it, really thought about it. The memory problems had started about 3 months ago. But had they really? Or had Marcus just started pointing them out? Had he been suggesting them to me so often that I'd started to believe them? Had he been planting the idea that I was losing my mind so firmly in my head that I'd begun to see evidence of it everywhere? "I need to go," I said to Eleanor. "I need to think about this." But I didn't need to think about it. I already knew what the answer was. I'd known it since I walked out of Dr. Voss's office. I'd just been trying not to know it. Marcus left the next morning. He had to get back to work, he said. But before he left, he hugged me and told me to call him if I changed my mind about the surgery. He told me that he loved me. He told me that he was only trying to help, and I let him hug me. I let him say these things. I didn't confront him. I didn't accuse him. I just let him leave. After he drove away, I sat at my kitchen table with my laptop and started pulling together everything I needed. My medical records, my financial records, emails from Marcus. Notes from conversations. I was building a picture of manipulation, of gaslighting, of a son who had decided that his mother was a problem that needed to be solved. I called a lawyer, a woman named Catherine Chen, who specialized in elder law and financial abuse. I told her everything. The surgery that wasn't necessary, the memory problems that weren't really there, the suggestions about my finances, the appointments that Marcus had insisted on attending. "Do you have documentation?" Catherine asked. "I have emails. I have medical records. I have a letter from Dr. Voss saying I don't need surgery." "That's good. That's very good. I want you to do a few things. First, I want you to contact your bank and remove Marcus from any accounts he might have access to. Second, I want you to update your will and make sure he's not listed as your executor or beneficiary unless you want him to be. Third, I want you to get a complete cognitive evaluation from a neuropsychologist, not a neurologist, a neuropsychologist, someone who specializes in assessing cognitive function. I want that on the record." I did all of these things. The bank was cooperative once I explained the situation. They removed Marcus from my accounts immediately. The lawyer helped me update my will, removing him as executor and leaving my estate to Eleanor instead. The neuropsychologist appointment took 3 weeks to schedule, but when I went, the results were clear. My cognitive function was normal. Better than normal for my age. The neuropsychologist said that my memory was actually quite sharp, that my processing speed was good, that there was no evidence of any cognitive decline. I had this evaluation printed out and put in a file. Proof that I was fine. Proof that I didn't need surgery. Proof that Marcus had lied to me. Then I called Marcus. "We need to talk," I said, "about the surgery, about everything." "Mom, I'm glad you're calling. I've been thinking about this, and I really think you should reconsider. I found another neurosurgeon who—" "Marcus, stop." My voice was steady, stronger than it had been in months. "I'm not having surgery. I'm fine. Dr. Voss evaluated me. A neuropsychologist evaluated me. Both of them said my brain is fine, my memory is fine. There's nothing wrong with me." "That's the memory problems talking," Marcus said. "You're confused. You're not thinking clearly. You need to trust me on this." "I trusted you," I said. "I trusted you, and you lied to me. You made me believe I was sick when I'm not. You tried to get me to have unnecessary brain surgery. You tried to get access to my finances. You tried to take control of my life." "That's not what I was doing," Marcus said, but his voice had changed. The concern was gone. Now there was just anger. "I was trying to help you. You're getting old. You're alone. You need someone to take care of you. I don't need you to take care of me by lying to me. I don't need you to take care of me by manipulating me into thinking I'm losing my mind." "You are losing your mind," Marcus said coldly. "You're paranoid. You're ungrateful. After everything I've done for you." I hung up. I didn't listen to whatever came next. I just ended the call. He called back 3 times. I didn't answer. He left voicemails. I didn't listen to them. He sent emails. I didn't read them. I changed my phone number and updated my email filters so that anything from him went straight to spam. Eleanor came to stay with me for a week. We sat in my living room and talked about what had happened, about how I'd almost let my own son convince me that I was sick when I wasn't, about how close I'd come to having unnecessary brain surgery, about how his manipulation had worked so well because it had exploited something I was already afraid of, the possibility of losing my mind. "Why did he do it?" I asked Eleanor. "What was he trying to get out of it?" "Money," Eleanor said simply. "He wanted control of your finances. Once he had that, he probably would have convinced you to move into assisted living. He probably would have had you sign over your house. He probably would have taken everything." "My own son." "Your own son," Eleanor agreed. The weeks after that were strange. I kept waiting for Marcus to show up at my house, to try to convince me in person that I was wrong. But he didn't. He moved on. I found out through a mutual friend that he'd told people I was unstable, that I'd cut off contact with him for no reason, that I was the one who was sick, mentally, not physically. I didn't try to correct this narrative. I didn't try to convince people that he was the one who was wrong. I just let it be. Some people believed him. Some people believed me. Most people just didn't want to get involved in family drama. But I knew the truth. I knew what had happened. I knew that my son had tried to manipulate me into thinking I was losing my mind. I knew that he'd almost succeeded. And I knew that I was fine. That my brain was fine. That my memory was fine. 6 months later, I had a follow-up MRI. Dr. Reeves was no longer my neurologist. I'd found a new one, Dr. Patricia Okonkwo, who was thorough and honest and who always spoke to me directly about my care. The MRI showed that my brain abnormality was exactly the same as it had been 6 months earlier. Not growing, not changing, not causing any problems. "This is completely benign," Dr. Okonkwo said, showing me the scans. "You don't need surgery. You don't need any intervention. You just need to have this monitored periodically. Every year or so, we'll do another scan just to make sure it's not changing. But based on what I'm seeing, this thing is going to stay exactly as it is for the rest of your life. And you're going to be fine." I felt something release in my chest. A tension I'd been carrying for months. A doubt that had been gnawing at me. I was fine. My brain was fine. I hadn't been losing my mind. I'd been right to doubt Marcus. I'd been right to get a second opinion. I'd been right to trust myself. "Thank you," I said to Dr. Okonkwo, "for being honest with me." She smiled. "That's what good doctors do." I returned to my normal life. I went back to work. I rebuilt my accounting business, which had suffered during the months when I'd been distracted by the surgery situation. I spent more time with Eleanor. I made new friends. I joined a book club. I took a pottery class. I did all the things I'd been too afraid to do when I thought I was sick. And I didn't hear from Marcus again. A year after the whole ordeal, I was sitting in my office going over quarterly reports when my phone rang. It was a woman's voice, someone I didn't recognize. "Is this Adaira Davidson?" she asked. "Yes, this is she. My name is Jennifer. I'm calling because I'm married to Marcus Davidson. I'm calling because I need to know if what he's telling me is true." My heart rate picked up. "What is he telling you?" "He's telling me that he thinks I need brain surgery. He's telling me that I have memory problems. He's telling me that I need to see a neurologist and that he should come to all my appointments. He's telling me that I'm getting old and confused and that I need him to take care of me." And I'm starting to believe him. But something doesn't feel right. And I found your name in his files. I found emails between you two, and I'm wondering if this is something he's done before. I closed my eyes. I thought about Marcus, about the careful way he'd built his narrative about my declining health, about how he'd isolated me from other opinions, about how he'd tried to take control of my life. "Yes," I said to Jennifer, "this is something he's done before. To me." I spent the next hour on the phone with her. I told her everything. I gave her the name of Dr. Voss. I gave her the name of my neuropsychologist. I told her to get a second opinion. I told her to check her finances. I told her to be very careful. "Thank you," Jennifer said when we were done. "Thank you for telling me this. I think I need to make some decisions about my marriage." "I'm sorry," I said. "I'm sorry that he's doing this to you. It's not your fault. It's his fault. But I'm grateful that you warned me. I'm grateful that you're willing to tell the truth about what happened to you." After we hung up, I sat at my desk for a long time. I thought about Marcus. About whether he was doing this to Jennifer out of some genuine belief that he was helping her, or whether he was doing it out of pure manipulation. I thought about how many other women he might have done this to. How many other people he might be doing it to right now. I called Catherine Chen, my lawyer, and told her what had happened. She said that what Marcus had done to me was potentially illegal, that it could constitute elder abuse. That I could file a report with Adult Protective Services if I wanted to. Do you want to? Catherine asked. I thought about it. I thought about what would happen if I filed a report. Marcus would probably deny everything. He'd probably claim that I was the one who was unstable. He'd probably turn it into a he said, she said situation. And I wasn't sure that would help Jennifer or anyone else. No, I said finally. I don't think that's the right move. But I want to make sure that if anyone ever asks me about this, I tell them the truth. I want to make sure that my story is documented somewhere. I can do that, Catherine said. I can put together a written account of everything that happened, and I can keep it in my files. If anyone ever needs to know about this, it will be available. I spent an afternoon with Catherine, going through everything that had happened. Every conversation with Marcus, every medical appointment, every email, every lie. By the time we were done, I had a comprehensive record of my son's manipulation. It was painful to document. It was painful to see it all laid out in chronological order, to see the pattern of his deception so clearly. But it was also necessary. It was proof. It was evidence. It was the truth. Today, I'm 59 years old. My brain is fine. My memory is fine. I haven't heard from Marcus in 3 years. I don't know if Jennifer left him or if she's still trying to figure out what's real and what's not. I don't know if he's done this to other people or if I was just one in a series of victims. What I do know is that I trust myself now. I trust my judgment. I trust my memory. I trust my instincts. When something feels wrong, I listen to that feeling. When someone is trying to convince me of something that doesn't make sense, I get a second opinion. When someone is trying to control me, I push back. I know that family can hurt you in ways that strangers never could. I know that the people closest to us are the ones who can manipulate us most effectively. I know that love can be used as a weapon. But I also know that I'm strong, that I'm capable of seeing through lies, that I'm capable of protecting myself, that I'm capable of building a life that's good and full and real. If you're experiencing something similar, if someone in your life is trying to convince you that you're sick when you're not, if someone is trying to control your medical care or your finances, if someone is making you doubt your own mind, please talk to someone. Please get a second opinion. Please trust yourself. Because your instincts are probably right, and the people trying to manipulate you are probably counting on you to doubt them.